Good afternoon. I'm Jumal Khalili and welcome to this week's Independent Sage weekly news briefing. As you can imagine, today is a very busy day, a very important one, and we've a lot to get through. Just to give you a heads up, we have joining us to ask questions the Shadow Health and Social Care Secretary, Jonathan Ashworth, Dr. Rosanna Allen Khan, Labour MP for Tooting, as well as a number of journalists and members of the public. So I'm just hoping we can get through as much as possible. Well, the situation with COVID-19 is, of course, changing daily. It seems almost hourly sometimes, but we're all aware that cases are rising, in fact, doubling every week in the UK now. And we're running out of time to get on top of this crisis before it absolutely spirals out of control. So let's get started. And we're going to kick off, as always, with a presentation from Professor Christina Pargel with this week's latest figures. Christina.
Hi, everybody. I hope you can see my screen. So today's presentation is going to be a little bit different because I really want to dig down into where we are right now with COVID. So the headlines are that there are delays in testing and the ability to get tested, and they're getting worse. That new cases are going up by any measure. Hospital admissions are now rising rapidly. And then just like talk a little bit about what this means and where we kind of sit in the international context, and then end with a summary and then a plan of action, which is then going to be presented by Professor Stephen Reicher. So just starting on testing. So the different nations all have different ways of assessing timeliness of getting your test results back. And actually, I couldn't find the data for Northern Ireland, but in Wales, it looks like testing times are holding up, that they've been steady since end of July. So they're not yet affected by delays in getting your test results, although I don't know about the difficulties in actually getting a test. In Scotland, contact tracing is getting slower. So their measure is the percentage of new cases that were interviewed by a contact tracer within 24 hours. That was 37% in the first 2 weeks of September, and that was down from 43% 2 weeks before. In England, things aren't looking particularly good. This is a measure of the percentage of test results received within 24 hours of the test for various ways of getting a test in the community. And then the thick black line is the overall line. Everything has gone down between the last week of August and the first week of September. And overall, just 9% of test results in England were received promptly in the first week of September. And that's just another sign that the testing system is under real strain. And it really matters for contact tracing. You really do have to get in touch with contacts as soon as you can. So these delays do matter. And then I'm not going to say anything more about test and trace, really. I mean, it's been in the headlines all week. There are shortages of tests. Dido Hard